See, ma'am, the most common cause of a shoulder pain is again ergonomically weaker architecture around you. You're sitting when you're working from home. You're working out of out of chairs which are not meant for prolonged sitting. So these kind of things, and then your laptop is not positioned appropriately. So these things lead to your neck pain. The neck pain slowly start moving out to your shoulder, and then you're using your keypad and the mouse pad at in different angles, and you're keeping your hand suspended for prolonged hours of time as you move your mouse around and all that. So this leads to all these shoulder pains and neck pains. And some of the patients also complain of tingling sensation in the fingers. Some of them have wrist pains, elbow pains, wherein they will have pain even when they lift a glass of water and move a mouse around. And one more most common thing is even when they turn the doorknob of your office door and push the door, they feel that pain in the elbow. All these are signs which say these are all signs of an overuse injury. Overuse because your muscles are being used quite a lot. So one thing is you need to exercise properly again. And then the second most important thing is, when do you visit a doctor when these symptoms occur? Because these symptoms are quite of common occurrence. Does not mean that you will have to visit an orthopedician every time you have a pain. The first most common thing is prevention. How do you prevent yourself from occurring all these? Is adapting yourself, studying your own techniques, wherein you need to study as to what are the movements or what are the positions which is aggravating the pain. So prevent yourself from putting yourself in these situations, and then you seek an orthopedician only if the pains continue to persist beyond, say, 4-5 days, in spite of you adopting these changes. In spite of doing an ice pack or a hot fomentation, the pains continue to persist. In case you're feeling a tingling sensation or a little numbness which is going down your hand, and then you feel your shoulder movements are getting restricted, or the pain has reached an intensity wherein your everyday activities, like even holding a glass of water for drinking a water, turning a doorknob is getting painful, that is the time you visit, just to make sure that there is nothing else which could be wrong with you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.